بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما اللهم لا سهل إلا ما جعلته سهلا وأنت تجعل الحزن إذا شئت سهلا سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم أسأل الله تبارك وتعالى أن يجعل نياتنا خالصة لوجهه الكريم السلام عليكم ورحمة الله تعالى وبركاته. We welcome you to another session of our nightly discussions during this Black History Month, where we highlight the efforts and the endeavors of members of our community and members of the Muslim family who have different talents and expertise and careers that we thought would be beneficial to share information about them with our audience, those who attend our lessons and gatherings, so that we can, promote positivity during this month and highlight some of the efforts of African Americans that have excelled in not only religious sciences, but also in worldly sciences. So today we have with us Dr. Sadiq, who is a doctor in pharmacy, and Dr. Aliyah, who is a doctor in dentistry. So these are two fields of study and that are progressive careers, and and they are Muslim women. So we wanted to share with you some of their experience and share in the benefit of their expertise. So inshallah, we will open up with giving them a brief introduction, a few minutes each, 5 to 10 minutes if they like to take, telling about their field of study and a little about what made them interested in pursuing a career in pharmacy or dentistry, inshallah ta'ala. So we'll leave it to which one wants to speak first.
Well, I'll go first. Assalamu alaikum, everyone.
Okay.
Bismillah. So my name is.
We're going to turn off our mics so that your mic comes. 1 second. We're going to turn. Dr. Sadiq, can you turn your mic off? And I'm going to turn mine off so she is clear.
Yes.
Assalamu alaikum. So my name is Dr. Aleem. I'm a doctor of dental medicine, or a dentist. I first got interested in dentistry from my older sister. Kind of a funny story. She had something going on in her mouth one day, and I was really little. I was like 7 or 8, and I looked inside. I was like, "What's going on?" And she was like, "That's not gross to you?" And I was like, "No, I don't mind at all. Like, I want to see." And so it was always something that I kind of kept tucked in the back of my mind as a possible career to go into as I got older. But I made the decision when I was an undergrad to major in the sciences. So I minored in chemistry. I did journalism major. In addition to high school, so once you finish high school, you have 4 years of undergraduate degree that you have to complete. I did a master's, so I took a year to do that, and then 4 years of dental school. So it's about 8 to 10 years, give or take, of extra schooling on top of high school to complete to get your doctorate in dentistry. There are other programs that are like accelerated. They combined undergrad and dental school together, so it's like 7 years instead of 8 or 10. But it'd be 8 years minimum. I currently work in a federally qualified health center, so an FQHC. So it's basically like the safety net type of clinic, and so it's for the people who don't really have insurance or in between jobs. Or can't afford regular dental treatment in like a private practice. So I see a lot of patients in the communities that need it the most. And I've been working there for about a year almost. So it's been very nice. That's pretty much it.
Okay, Dr. Sadiq, inshallah. If you can, Dr. Alim, if you can put when so the mic comes through clear. Barakallahu biki.
Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Wa salatu wa salamu ala Rasulullah. I originally thought about healthcare professions in general just because my mother worked in the health field and my parents had advocated going into something health related. I wasn't a hands-on person, or I'm not a hands-on person. And so to still be able to work in that field and feel like I'm helping others, I chose pharmacy simply because, like I said, it wasn't hands-on, but I could still feel like I could help people and I could still interact with patients. For me, it took about 8 years to get a pharmacy degree. I did 4 years of undergrad, in which I majored in chemistry. And then I did 4 years in pharmacy school, so that was 8 total. I did an extra year in between just because I was taking extra classes. And I decided to go into retail setting. That way I could have that patient interaction. A lot of my colleagues went into hospital medicine, hospital pharmacy. But for me, I really like the retail setting, mostly because, like I said, the patient interaction, I got to advise a lot of patients. And I really like working also in the economically challenged areas where, a lot of people come in for advice and they don't really have access to the doctors like that they can just call. And so when there's a lot of over-the-counter medication that they need advice on, felt like I could help them in that area. What else? Right now, I also like that it was a job that I could feel like that I could do part-time once I started having kids. And so it had a flexible schedule. So that was always something that was important to me, that I would be able to still work and have a family at the same time, because I know working full-time and having a family is a lot. And so I always thought about wanting to be able to do part-time when that time arrived, when I started to have a family. That was another reason of going into pharmacy. And I've been working for about 17 years. I want to say 17 years. And what else? I don't know. That's about it. Is there anything else? I'm sorry.
Question,
Yeah.
and I'll go to Dr. Alim, and then I'll come back to you, Dr. Sadiq. What is the most fulfilling thing for you about your choice of career? So in your case, Dr. Alim, dentistry. What is the most, if you say, this is the most fulfilling thing for me, and this is something that I think people would make someone, like especially our youth or people who are going through school, want to do this type of field or engage in this type of field?
I think for me is the ability to restore someone's smile. That's when you don't have it, it becomes so detrimental to your quality of life. And I've had patients cry in the chair because I was able to help them, give them teeth again, or take them out of pain, or just like soothe their fears, or like ease their fears or worries about going to the dentist, period. So for me, it's definitely helping people be able to smile, because like dental or oral health is one of those things that you don't really think about until it's taken away from you. If you've ever had a toothache, if you've ever had anything like that, then you know exactly what I'm talking about. But just being able to restore a smile is a huge blessing, I think.
As a Muslim, and this is related to what you just said, as a Muslim, how do you relate that feeling you get to your Islam? What connection do you find in that?
Yeah, so before I start working, I always make like a small dua, just so that way, like if it's difficult, make it easy for me, make it easy for the patient. And I find that like being able to help someone smile, even like because smiling is a form of charity, even a small thing like that. So I think that that's just a really like, it's a really cool blessing to be able to do, to give that to someone, to help someone have that, and to be of service like that to someone. It's nice.
I want to share a story. One of my teachers, he had a dentist, and my direct teacher, his brother was the dentist for this well-known scholar. And one day, when that scholar was coming to have, some dental work, he asked the dentist, he said, "What do you intend when you go to work?" And the dentist was, "Nothing, I just intend I go to work." He said, "No." He said, "Intend," because he had his own dental clinic. He said, "Intend, number one, sort of that intention. You said you like to make people smile, which is sunnah, right? The Prophet ﷺ was one, every time you would meet him, he would have a happy face, right? And smiling is a part of that. He said, intend to serve people, because especially in the Middle East, in that country, I won't name the specific country, but they cheat a lot. So if you like, and people don't have insurance a lot, so they make bills. They really kind of unjust in their pricing. He said, intend that you're providing a service that would bring justice to a service that was unjust, right? And make sure that you're always fair in your pricing. He said, and if you had that intention every time you go to work, that is a reward, right? Because the Prophet ﷺ said, the one who cheats us, deceives us, and that could be in making prices higher or giving inferior product, is not among us. So as a dentist or any other field, this is a noble intention that one can make, and besides earning one's wealth, but one is also turning that act of work into an act of worship. So, when you're thinking of making a smile, connect that to the sunnah of the Prophet ﷺ. As the Prophet ﷺ mentioned, that don't consider anything small, even if it's meeting your fellow person with a smiley face. SubhanAllah. That's a beautiful thing. Inshallah, mashallah. I'm going to ask Dr. Sadiq the same question. When
You're on mute. Imam, I mean.
did you hear me? Or all of that didn't come out? Or
I didn't hear any of it.
Oh, for me. Oh, you heard my person about the intention, right? Y'all heard that, right?
Yes.
Okay. Mess it up. For you, what is the most fulfilling thing that you get out of your career in pharmacy and pharmacy work and working as a pharmacist? What is the most fulfilling thing for you out of that career?
I would say the most fulfilling thing would be just knowing that I helped someone. A lot of times there is patients who are trying to navigate their way through all the over-the-counter medications and herbals, and they're on top of that taking a lot of their own prescribed medications. And a lot of times that's difficult for them to know what they can take and what they can't take. And to be able to offer that advice to them and know that, I can be of some help and some assistance in that area is really what's most fulfilling for me, especially when they come back and they say, what you recommended really helped, and they really appreciate me taking the time to take time and speak to them and to have to care about their health. A lot of times when you go to the pharmacy, it's a lot of the same patients because they're on those chronic medications that they're going to be on pretty much lifelong. So you get to know them because they come in every month picking up the same medications. And I really liked having that relationship with them, and we would, get to know what's going on with each other's lives, how their health was doing, what their medication was doing, anything they wanted me to speak to their doctor about if they were running low on something. So just being able to help them is what I found most fulfilling.
We have our first question, and I guess that is for Dr. Aline. You can see the question? You're on mute.
Yep,
Okay.
I can see it.
Yeah. So how do you get your children to love brushing their teeth without always having to be forceful? My smile could be better. They don't understand how important dentistry is. Good question, mashallah.
So children do best with repetition, one, but also replication. So like if they see you brushing your teeth, if they see you taking the time to make it an important habit, they will replicate, even if it's just like taking the toothbrush and kind of just playing around in their mouth. However, with the little ones, like 3 and under, you are going to have to be a little bit forceful, but there's a gentle way to be forceful. So it doesn't have to be like, you better brush your teeth or I'm going to hit you. But it does have to be some type of structure around it. If you have 2 people in the house that can like hold the kid in a specific way, you can always YouTube like how to brush like toddler teeth or really little ones like 2-year-olds, 1-year-olds, because you should be brushing their teeth even when they're 1 and 2 years old. But yeah, there's just different ways, different techniques. They do have a whole lot. Like even if you just Google it, there are a lot of ways. But the best way I found is with the parent being like very involved in brushing their teeth, and then the kid sees it and they're like, I want to do it too.
One of the follow-up questions you mentioned about with toddlers, how often should the brushing be, and how often, like, so we're talking toddlers 1 to 3, when they start getting their teeth, and what type of toothbrush should be used, and how often should they visit the dentist?
Okay, so the first dental visit should be when the baby gets their first teeth. So my youngest patients are about 26 months because that's usually sometimes when they get their first teeth on the bottom. That appointment is not really to do anything. It's really just to teach the parent how to take care of the kid's teeth at home. And so the type of toothbrush that I tell my parents to use is extra, extra soft, very, very gentle. The brushes, they're kid little brushes, and they should be extra soft bristles. If you can't get to the store and don't have a toothbrush, you can use a washcloth. Just put the washcloth on your finger and just use it to kind of move around in the kid's mouth. The name of the game is getting them used to the act of something cleaning their teeth, because it's going to be a lot easier when they get 3, 4, 5, when they actually have like a mouthful of teeth that really do need to be brushed, to have them in the habit of that. So the earlier you start, the better. And they should be visiting the dentist at least every 6 months. So from their first tooth, about a year old, or their first tooth, and then after that, every 6 months.
Are there special dentists for that, for the toddlers, or that's something that most dentists would involve themselves in?
So most general dentists don't like to be bothered with kids, don't like to be bothered with pediatric dentistry, because it takes a little bit more time, because you have to spend a little bit more time talking to the kid, getting the kid to relax. So there are special dentists, they're called pediatric dentists, but a lot of general dentists are able to see them. It's just if they want to or not. So in the type of clinic that I'm in, I see everybody. So I see little kids from a couple months to 70, 80-year-olds. And it's definitely an adjustment working on little ones, but it's really rewarding once you get the kid to trust you. It's nice.
Dr. Sadiq, in your field, how important is your field in relation to the medical field? What is its level of importance and priority within the medical field as a whole?
Well, in terms of importance, everyone knows that the medical doctor is most important because he is responsible for diagnosing you and putting you on a path to wellness. As pharmacists, we help you on that path to wellness, making sure that you adhere to your medication and are taking things according as they are prescribed and keeping in contact with your doctor in regards to how your progress is going. A lot of times we are the middleman between the patient and the doctor when the patients are able to make an appointment, or when they're running low on medication, or if they want things adjusted and things of that nature. The doctor will sometimes speak to us as the middleman before the patient picks up their medication.
And here's a question for you, Dr. Sadiq. Is there anything you would recommend that people can ask their doctor for to relieve chronic back pain other than opioids?
There are a lot of other classes of medications out there for pain relief aside from opioids. You would have to specifically ask your doctor for that for medications aside from an opioid. You would tell him, I do not want opioids. Is there anything based on my condition which you can recommend? And it's very patient specific sometimes in terms of what the medications you're taking, what allergies you may have. So if you ask your doctor specifically about pain medication that are not opioids, and he would be able to work with you to find something that's specific for you and that would work for you.
Sheikh Issa, I'm going to need you to behave yourself. That guy is funny. MashaAllah. He's a funny guy. Alhamdulillah. Where's the other question? I'm sorry. All right, I'll find the other question. In the meanwhile, I'll give you another question. Dr. Sadiq, are you just important as the MD? I am an RN. I call the pharmacist before I ask the MD to adjust my, okay, you got that question, whatever that word is, vancomycin.
His vancomycin.
Yeah, I'm sorry. That's like Arabic. Go ahead.
Depending on the setting, a lot of times the pharmacists work with the doctors in adjusting the medications. We get the levels from the patient's labs to see that where their therapeutic levels are and that sort of thing. So if we can make a recommendation to the doctor, if his levels are a little bit out of range, if they needed to be adjusted, then that recommendation would come from the pharmacist at times.
And this is for both of you, so each one of you can have your own experience. Since you both work with the public, has wearing your hijab to work ever come into question in your fields as Muslims?
For me, it hasn't, simply because I interviewed with my hijab on, so it wasn't a surprise. They knew exactly what they were getting. So if I interviewed with the hijab, it would go to reason that I would work with my hijab. So it's never been a problem, just because I showed up as I presented myself as I was coming to work.
MashaAllah.
It hasn't been a problem for me either. But I will say that some hijabs do get in the way on around the neck area because I'm leaning over patients, and so if it's drapey, I have to tuck it into like my white coat. But other than that, no.
Let me ask you a question, a follow-up question for both of y'all related to that. Do you find that it's easier, especially as both of y'all are Muslim women, do you find covering and being a Muslim woman is easier in the medical field because you're both in that type of field than in other careers from other Muslims you know? Do you find a more facilitation for the Muslim women in the medical field as opposed to other fields? From your, because you went to school with people, friends, you have Muslim friends that are maybe in different careers. So you talk, do you find a difference in that?
So I don't think it's necessarily easier or harder. It comes with a different set of challenges because a lot of what I do is based on a lot of how patients feel in the chair is based on like a 10 to 20-second interaction before I have them lean back and get into this very compromising position it feels for a lot of people. So first impressions matter a lot. And so for some patients, it is off-putting that I'm in a hijab. And so that's just a different challenge. So I wouldn't say that it's easier being in the health field. I will say though that there are a lot of Muslims in the health field. So it's not uncommon to see other hijabis, different races though, but other hijabis around. But as far as like patient interaction goes, that presents a different set of challenges.
Dr. Sadiq?
I have to agree. I wouldn't say it's easier. I would say that it depends on the interaction with the patient. I spend a lot of time with the patient, and as long as you're courteous and they feel like you actually care about their health, they receive you in a well manner, regardless of the hijab or not.
Was a question for Dr. Sadiq, I would assume, or maybe both of y'all. I don't know, because I don't know. I'll leave that to y'all. Y'all see the question there?
So, in general, no medication is bad if you are using it as it is prescribed and what it is intended for. Some patients respond better to different medications. So we can't just say that is pain medicine bad. Some people need their pain medicine and it is helping them. So depending on the situation, on the patient, it's a lot of pain medication is patient specific, just like a lot of medications are patient specific. So it would depend on the situation. If you're having a bad reaction, or if you're feeling like it's not doing well for you, then you can switch to something else.
Another question to both doctors. If you have children, do you feel it is important for your children to follow in your footsteps of becoming a doctor as well?
I would say yes and no. Yes, I recommend it. In addition, my husband also has a good job in his field, and so if they wanted to go into that, that would be an option. But not a lot of options. I really need them to excel in whatever it is that they do. I'm sorry.
I don't have children, but if I did have kids, I would definitely encourage them to follow in my footsteps, because we need to get this legacy popping. We need to get the ball rolling, and I need to have a practice that I can leave to my children. Because in dental school, there were a lot of second, third generation students whose dads and granddads owned dental practices. And so I was like, wow, it must be so nice to just be able to walk out of school and just walk into a practice that you are going to own in a couple of years when your dad retires or your mom retires. So yeah, I think it's important.
So question follow-up to what you stated, which is interesting. And that's for both of y'all. Have y'all ever thought about, or you mentioned it, so that's an indication. They have a saying, they said, Fil ishara ibara. Once you make an indication, that's a clear expression, which means that you are thinking of your own practice. So that's Dr. Aliyah.
Oh yeah, inshallah. Inshallah. That's the plan. That's the goal.
And did you plan that out as you were in school, or once you started working, or was that something when you're going into this field, that was always an intent of yours? And why?
Yeah.
What is the main reason besides the legacy?
So I like the autonomy of being a business owner.
Me too. So,
And be I like that I could be the boss. I like that I have the opportunity to own something and to then pass that legitimate business. All they got to do is just go to school to my kids. And so yeah, I thought about that as definitely as a reason as to why I wanted to do dentistry, for sure.
Dr. Sardik, have you ever thought of something like that?
I had great aspirations at one day opening a diabetic clinic. I feel like our people suffer a lot from diabetes. And so it's one of those diseases that if you really get a handle and manage it, you can do really well. You can have really great outcomes. But a lot of that comes with education and diet management and medication management. And so when I did a rotation in a diabetic clinic, I really saw those patients excel. They weren't on as many medications as everyone else was. And in our communities, we it's like diabetes is the African American disease for some reason. And so I thought about opening a diabetic clinic early in my profession. But in Alhamdulillah, I had kids and had to sidetrack that ideal. But if anyone is willing to take that ideal and roll with it, I support you.
Um, in relating to diabetes, since you had an interest in that, how easy is it once one goes on uh, diabetic medication to come off of it? And what do they usually need to do that?
So normally you would need to get your glucose levels under control. And if you are very active early on in managing that, you can see a reduction in your medication. But you have to be very diligent and very dedicated. And if you struggle with a diet, it's sometimes hard for people to get a handle on that because it was years of having that particular diet that caused that condition. So it's very difficult for people to just do a 180 the next day once they find out they have the condition. And so a lot of times, um, the dedication, the hard work, the knowledge, a lot of that is missing. They're missing a lot of pieces in order to get to that hurdle of decreasing medication and not being on it.
If someone, as you said, so many of us in our communities are struggling with these issues, uh, what would be three main advices you would give them? Not actually for necessarily uh, uh, to give the medical part of it, but if you say these three things, if you have this struggle with diabetes, these are three things you should be aware of and focus on.
The first one would be diet. So that is one of the main causes of diabetes is, having your sugar out of control or your glucose level out of control. So diet is 100% the main focus when you have that health condition. Secondly, it would be keeping track of your numbers and exercising because we know with exercise, it helps the body to bring the glucose levels down because the cells can take in the sugar and utilize it. And thirdly, it would be having knowledge of exactly what your condition is. So a lot of times we go to the doctor and they say, you have high sugar, you need to take this medication. But there isn't this whole, you know, class. I think people should just take a class on your condition so you can fully understand it. And I think if people fully understood it, they could work a little bit better at navigating how to manage it, I would say.
There's some common questions. There are a few. This one is for Dr. Aline.
Yeah, absolutely. A lot of systemic conditions.
Could you read the question?
Yeah, sure. So, Dr. Aleem, is it true that a dentist can be alerted to serious health problems through oral health? Yes. So, I have a colleague who alerted a patient that they may have HIV just by looking at the mouth.
Wow.
Yep. Pregnant can show signs in the mouth first if the woman's unaware. Other systemic things like diabetes does play a huge role in how sores can present in the mouth, how a patient is healing. We take all the vitals beforehand. So if a patient has a complicated history, a complicated medical history, and that's including diabetes, hypertension, anything systemic, I always see their numbers first, just to make sure that it's safe to proceed. But even with all of that being okay, some of the things that can fall through the cracks, like oral cancer, um, I can catch that too. So yeah, absolutely.
Here's another question for both of you. I'm looking for other questions, so if y'all can read the question and answer, inshallah.
Assalamu alaikum, Dr. Sadiq and Dr. Aleem. How can we educate the Black community better about healthcare and maintenance thereof? I'm currently an LPN to RN with aspirations to finish with my DNP, inshallah.
And these are only possible if she stopped giving me a headache. Now I'm joking. That's our beloved sister Anissa. May Allah reward her. MashaAllah. Go ahead.
So, in terms of how we can educate the community better about healthcare, I feel as if it's one of those things you have to take personal accountability for. Like everyone should be in charge of their health, just like they're in charge of their soul for the afterlife. Like you really should take an active role in your health. You should know what your numbers are in terms of blood pressure, in terms of where your glucose levels are, how often you go to the doctor, keeping track of how often you exercise. It's really a personal accountability type of situation, in my opinion.
Dr. Alim, you want to answer that too? It go both ways. Get both of your opinions, different fields.
No, I do agree that a lot of it is personal accountability. I agree with that. As healthcare workers and healthcare providers, I do think it is important, though, when I'm talking to my patients, to try to explain things, specifically my Black patients, in a way that they can understand and that will resonate with them. Because I know that I only get about a couple minutes with them, and then they're off to live their lives essentially, how they see fit. But while I'm in the room, I try to tell them, I try to explain things to them in a way that I think will land with them. But yeah, I do agree. A lot of it is just personal accountability.
Okay. These questions, some of them are specific. So maybe if you could answer specifically, good. If not, and just some general things they should ask their doctors. So
I'm a chronic asthmatic recently, but my asthma was so exacerbated. They put me on prednisone daily, 20 milligrams. I've read the side effects. Do you think prednisone is something I should take daily? Just looking for another opinion. I've been intubated recently because of COVID. I think they released me prematurely. So, in regards to prednisone, you'll see a lot of asthmatic patients on steroids long term because it helps with the inflammation of the lungs. And there's not a lot of things that you can substitute for steroids in general. So, steroids is like a class of their own. So, even if you're on like an oral prednisone, you would find some patients on inhaled steroids as well. And in addition to it being a unique situation because of your COVID, that's really something you have to ask the doctor about so he can look at you specifically and see what would work best for you. But a lot of patients are on those steroids who have asthma long term.
I guess that is, do we eat too much meat? And I don't know what it's related to, or it could be something related to the comments. But I guess if one of y'all want to take that question.
I don't know how much meat someone eats. I don't know. I don't eat a lot of meat, so I don't know. I can't answer that really. I don't know.
I mean, we were talking about diabetes, and is there any relation to the amount of intake of meat related to that? Or I guess high blood pressure, because they were talking about those two things as well. Is there a connection with eating too much meat between either one of those diseases or sicknesses?
I believe everything should be done in moderation. So if you're sticking to a moderate diet, inshallah, you should be fine. I do not think you should overindulge in anything necessarily.
What about gluten food?
Depending on your allergies, if you have a gluten allergy, a lot of the food nowadays are genetically modified. So the food you were eating years and years ago is not the food you're eating today, essentially. So a lot of that has to play into what you're eating. And so a lot of people are doing organic diets and gluten-free diets because they have the allergy. I don't have a gluten allergy, so gluten food is fine for me. But like I said, a lot of this is patient specific.
This is for Dr. Alim. What oral signs of HIV would appear?
A very common sign is to have a sore in the corner of your mouth. That's a telltale sign. Or something. Sometimes it kind of looks like candidiasis or like yeast in the mouth. That could also be an indication.
Mm. I don't know if this relates to both of y'all. So how do you feel about natural medicine?
I don't mind it. I think it's nice if it works. A lot of my patients sometimes have long-term toothaches, and they ask me what can they take or what can they put on their tooth to make it feel better. Sometimes I'll suggest that they put clove as an alternative to taking a lot of like ibuprofen or Tylenol. But it just depends if it actually is working for the patient.
Dr. Sadiq?
My feelings on natural medicine is, as Dr. Aaliyah said, it is if it is working for you, then it wouldn't cause a problem. A lot of times, the only hesitation I would have is individuals self-diagnosing themselves and then finding a natural cure without actually being properly diagnosed and kind of trying to heal themselves without knowing exactly what may be going on.
Uh-oh, here comes the hard question. I knew it would be coming. Bam.
I have no thoughts about the vaccine.
I second her. No. So my thoughts about the vaccine, I think that everyone should look up the pros and the cons, weigh your risks, and if it makes sense for you to take it, then take it. If you feel like you don't need to take it or that you don't want to take it, then that is completely up to you. I think it's very much so up to you if you want to take this vaccine.
One of our teachers, were asked the same question, and he was like, "As for us, for me," he was talking about himself. He said, "I'm not taking it, but don't take my position for your health, right?" And someone asked me that after Jumu'ah, and they from the city, and they were saying like, "Can we have the vaccine administered at the masjid?" And I said, "Listen," and this was just my thoughts. There are some people I'm concerned about them, and it may work for them. If you don't have those same concerns and you feel safe, mashallah, who can go do what you got to do. But I think one of the things in general, these things are real, right? Coronavirus is real. Alhamdulillah, my whole family had coronavirus. We got over it, alhamdulillah. But some people, they got coronavirus and they died. So I would say from my end, it is not a pleasant feeling. But what I experienced, natural things work very well. And that's what I did. And my family did. And it worked, you know. But I don't know if that's the medicine for everybody, but it worked for us. So, you know, I would suggest everyone do the proper research, investigation. And in this case, consult your heart after you do your work, you do your homework, you do your investigation, consult your heart, you know. But I think we should be careful to impose our personal feelings on others who may not have the same conditions as us. And Allah knows best. That's my total non-professional answer. But experience is a teacher. And since I experienced it, others have come to me who caught corona, and I gave them the same thing I did. And so far, everyone that came to me is well. So I can advise you from experience what works. What worked for us. I know it's going to work for everyone, but everyone that we told that I know, and I know several people, it worked for them. But maybe they didn't have, you know, pre-existing medical conditions that don't work for. So in my private practice, I will advise, and as Dr. Alim said, we like to have our independence, so it's going to be, I'm just joking. Go ahead. Okay, there you go. Y'all see the question? I'm going to go down and look for more questions.
As a Black woman, what advice would you give regarding getting a second opinion on a diagnosis to make sure it is what they say you have so that you don't get misdiagnosed? No particular sickness is referred here or condition, i.e. pregnancy and mental health. I absolutely would suggest getting a second opinion. So that's the beauty of having a healthcare system where you can go to more than one provider if you want to. So sometimes it takes getting the second opinion from a completely different doctor who has no ties to your case or doesn't really know you, to trust what the original opinion said, or it's a way to discover a different way of treating a condition. So I absolutely suggest getting second opinions, 1000%. And if a doctor or if a provider ever denies you treatment, just ask, or just to make sure that it's being documented that they are doing so, because that's important too.
Dr. Sadiq, any additional input?
I totally agree with her. There have been times where I have gotten second and third opinions because, like she said, that's the beauty of being able to go to different doctors and to see if they are in agreement with what your findings are.
Here's another question.
Question to both. Is it good to follow Dr. Sebi methodology on natural pain and healing? I'm really not too familiar with Dr. Sebi's method. I've only seen it in passing, so I really don't know what he prescribes or what he instructs. So I'm not sure.
Yes, unfortunately, I'm not familiar with Dr. Sebi either. So I wouldn't be able to comment.
That's for Dr. Alim.
So what is the average age a child's adult teeth should grow in? So the the child should have all of their baby teeth by the age of about 5. Their permanent teeth start growing in at the age of 6, so it'll start in the back. It's called their 6-year molars. So they'll get their first permanent teeth at about the age of 6, and then from the ages of 6 to about 12 or 13, they'll be shedding their baby teeth and having their permanent teeth grow in staggering. So sometimes they get them at 6, 8, 11, 12, 13. With the final adult teeth being their permanent wisdom teeth growing in at about 17, 18. But sometimes that doesn't grow in until all the way until you're about 20. But yeah, 6 years old is when the child gets their permanent teeth, starting to get their permanent teeth.
Okay. Dr. Sadiq.
Dr. Sadiq, how closely related is pharmaceutical field to Eastern medicine? Are you referring to traditional Chinese medicine when you say Eastern medicine? Is that what you're referring to? If that's what you're referring to, is not very closely related. A lot of traditional Chinese medicine is about prevention, staying well, getting ahead instead of treating after something happens. We are kind of like a reactionary type of medicine. We go to the doctor when we're ill. And a lot of traditional Chinese medicine is about staying well. So it kind of differs when it comes to the action point, I would say.
I guess that's for Dr. Sadiq.
My 9-year-old son has asthma and uses an inhaler about twice a month. What steps can I take to improve his condition? Is it possible for him to outgrow it? I have heard of cases of patients outgrowing asthma as they got older. Does this happen to everyone? Possibly not, but I have heard of a few cases where patients have outgrown asthma. In regards to what he can do to improve his condition, it has been found that sometimes there has been a link to diet and asthma being exacerbated, depending on what he's eating that can bring on or help or influence how severe his asthma reactions are. So I would definitely take a look at diet and speak to the doctor to see what else he could recommend.
Dr. Aline.
At what age would you recommend braces for a child who needs them? Depending on how many permanent teeth is present, probably around the age of maybe 10 or 11, um, depending. But usually, I don't really refer kids to get braces until their permanent premolars are in, or their permanent canines, the long teeth at the top. And that's usually like around like age 12, 13. Um, and sometimes it's a little bit earlier than that, because if you want to create space or maintain a space, they'll see the orthodontist to get braces before their permanent teeth grow in all the way, because if they can kind of like maintain the space for the permanent tooth to come in, then that's an option too. So basically around like 12, 11, 12, 13, 11 to 13.
No, there's another question for Dr. Aline.
So canker sores. How do you prevent canker sores, and what causes them? So canker sores are basically like small sores in the mouth. They're brought on by stress, trauma, acid, sometimes even the stuff in toothpaste, the sulfate, the sodium lauryl sulfate, I think it's called. It's really irritating, agitating to the tissue. So avoiding those types of things can help once you have a canker sore. So avoiding anything acidic, um, or to the mouth. Preventing them, there's not really much to do in terms of preventing them. It's just staying clear of the things that you know agitate your tissue or like irritate your gums or your cheeks.
There's an additional question for you, inshallah.
Dr. Aline, when I lived in Germany, the dentist coated my teeth with something and it preserved my teeth so long. And now I want the same coating on my teeth. What was it? And do you recommend whitening your teeth? I don't know what that could be. So I've learned that different regions have different methods of treating the teeth. Like, for example, in Europe, they use something to do a root canal with, like a material that we don't use here in the States. And I ran into it and had to do some extra steps to get it done. But I'm not sure exactly what that is that they coated your teeth with. I wonder if you can get back into contact with them and ask. Yeah, it wouldn't be composite or fluoride, so I'm not sure. And do you recommend whitening your teeth? Yeah, as long as you, I recommend whitening your teeth as long as your overall oral health is healthy. Then why not? But sometimes patients come in and the only thing they want to do is whiten their teeth when they have cavities and they need a lot of like work with their gums. So I think that disease control is what we call it. So managing your gum health, making sure you're flossing, making sure you don't have any cavities, and then whitening your teeth is the steps that I would do it in. But yeah, whitening your teeth can definitely be beneficial.
With Dr. Sadiq?
Yes, Dr. Sadiq, as a pharmaceutical doctor, have you noticed an increase in natural medicine since COVID-19? Do you suggest people to seek pharmaceutical doctors' opinion before beginning a natural supplement regimen? I have noticed an increase in natural medicines. People have been really trying to get ahead of getting COVID. And since there isn't a cure for it, a lot of patients are looking to natural medicines to help alleviate some of the symptoms and to help them heal. In regards to seeking a doctor's opinion before beginning a natural supplement regimen, I would say yes. A lot of times patients are taking things that their doctors are not aware of. And it is difficult, it kind of causes a problem for the doctor to treat the patient if they've already started something and they haven't exactly been diagnosed. So a lot of us will say, okay, well, I think, I'm suffering from this, and they'll research it and then go on their own. I think you should definitely seek the advice of your doctor. First and foremost, speak to him about some of the natural medicines out there, because sometimes he can help guide you to something that may work just as well or in addition to the medication that you're taking. So definitely seek the doctor's opinion. And another thing about the natural medicine, the Chinese medicine, I noticed that because I had a natural medicine doctor for a while. And one thing they like to do is they like to treat the entire body. Whereas Western medicine, we just treat what's bothering you, that particular thing. So if we come in for high blood pressure, the doctor, Western medicine, they'll give you medication for high blood pressure. But a lot of times Chinese medicine would try to treat your whole body to balance out the blood pressure. So they have this way of looking at the whole body as a system instead of, just looking at separate organs independently when treating. So that's one of the differences between that. Just wanted to clarify.
Imam, what natural remedies did you use? Inshallah, if you inbox me, I'll share them with you. It's all written all out, and I can share them with you, inshallah. But it's a lot of things. So if you inbox, I'll share it with you, inshallah. And it definitely wasn't my coffee. That's the last thing you should do. Okay, I think we're almost done. Thank y'all for your patience. Okay, I think we're done. Okay, wait a minute. That's for Dr. Sadiq. You're getting a lot of activity here.
Dr. Sadiq, what long-term pain medication or remedy do you recommend for a gunshot wound victim in the shoulder and bullet is still lodged? Currently, the person is on Oxy 5 and he takes 1,000 milligrams of Tylenol at least 3 times a day. Unfortunately, I would not have a recommendation for this patient simply because of the long-term condition that he's being treated, right? So this is something he has to work with the doctor with in terms of what would best work for him for his particular situation. I wouldn't be able to comment on that.
I don't know. That's a question. What can happen to your body and teeth, I guess, from wearing a face mask?
So there's no research or data describing what happens to the teeth from a face mask yet because it's all so new. So I don't think anyone's even thought to look into it in a very like serious way. But that would be interesting to know, like the increased humidity, what that does to the oral cavity. I'm not sure though.
Mm. I guess that's for Dr. Eileen.
Yeah. What are the risks of using activated charcoal to whiten the teeth, and is there a better alternative? So activated charcoal is really, really, really abrasive. So meaning, think about like taking like a Brillo pad or a steel wool, those little pads, and scraping at wall paint. So you don't want to use something that abrasive on your enamel. Your enamel is what makes your teeth white. And so, yes, in small, small, small doses, activated charcoal can whiten the teeth. But if you are using it raw and if you're using it too often, then you will end up with yellower teeth because what you'll essentially be doing is scrubbing away your enamel, the white part of your teeth, the teeth that make your teeth, the part that make your teeth white. You're scrubbing that away with this abrasive charcoal. So underneath that white layer is a yellow layer called dentin. So essentially, by trying to whiten your teeth with this charcoal, you'll be scrubbing away the white part, the whitest part of your teeth, revealing the yellow part. And after that, there's no coming back. You can't remake enamel. So there is definitely a better alternative. They're over the counter like whitening, like Crest White strips. Those actually do work. Or you can go into the dental office and ask for like a professional whitening, like Zoom whitening. A lot of people have core whitening, stuff like that. But yeah, just don't use activated charcoal on your teeth. Don't do it. Don't do it.
Dr. Sadiq.
Dr. Sadiq, do you notice that after the holidays that Americans practice a flood of children coming in with cold or minor illnesses after eating a lot of candy and sweet foods? I wouldn't say no more than usual. During the flu season, you'll see a lot of kids come in during that flu and cold season, which we're probably in from October to May or something like that, or March, I think it runs. So just during that flu season, you'll see more kids coming in. Not necessarily after the holidays, but the holidays do fall within that flu season range. So it is probably not related to the holidays, but more so the reason that it's flu and cold season, that it's cold and flu season during the holidays.
We're going to take this last question before we close out. And then we'll have some final comments from both doctors.
Do you feel the Affordable Health Care Act / Obamacare has been a benefit or impediment for the medical industry, i.e. prescription drug prices, consolidation of insurance companies, et cetera, et cetera? The medical industry, I'm really not sure. I'm gonna be honest. I was in dental school when all of these changes were happening. And so I've only interacted with patients after they've had Obamacare. So from what I can tell from the patient aspect of it, they like it and they were afraid of potentially losing it when it was up in the air way. So I'm not really sure how the impact was handled on the medical industry side of things, like with insurance companies and such, but the patients seem to like it.
The same here. I've seen patients have a positive response to having the Affordable Health Care Act or Obamacare. I've had patients say that their medications are a little bit cheaper and they were able to get better coverage or more coverage in addition to not being able to have coverage from before. So I've only heard positive things about it.
Okay, the last question, is really your closing. What advice would you recommend specifically African American youth and in relating to pursuing your respective careers? What advice would you give them, if you can, as a summary?
I think I would advise that to know that it's going to be a lot of work and a long road. So becoming a doctor is 8 years total. That's 4 undergrad and 4 medical. If you want to be a medical doctor, that's even a longer amount of time. So just be prepared to have that dedication through the long haul and to know that it is achievable, not to be discouraged and to continue working hard. And inshallah, you should succeed. Jahid to Shahid, as you say, Imam Amin.
MashaAllah.
I would agree that it's definitely going to be a long road, and just be ready for that. I would also encourage finding mentors in the fields that you are even considering about going into. So before I even applied to dental school, I shadowed a dentist. I shadowed several dentists to make sure this is really what I wanted to do. And sometimes finding a mentor can be tough, but cold emails are okay. Cold calls are okay. So what I mean by that is, if you just Google, I don't know, say you want to be a cardiologist and you like, I don't even know any cardiologists that I can talk to. If you just Google cardiologists in your area, look up the hospital, find an email address or find a phone number and do a cold call just to maybe try to get in contact with the person. Don't be afraid. Don't be afraid to find other means of creating like a network or a support system for yourself, because it is easier when there are people there to help you. But I know that there aren't a lot of these professionals in our communities, like readily available. So don't be afraid to go through the different avenues to try to find or create a community for yourself.
MashaAllah, we thank both Dr. Sadiq and Dr. Alim for their time and their expertise. It is very fulfilling to know that we have Muslims, African Americans who are, engaging in different aspects of the society and being successful, because it is, really something that is encouraging to all of us and something that we can be happy about. So we ask Allah to grant y'all both success in your pursuits in your fields and with your family and your life. May Allah raise your ranks and elevate your status and make you example for future generations to come, and inshallah allow you to establish that legacy you're looking for, inshallah ta'ala. And we'll all keep you in our dua and ask Allah to give you a tawfiq, give you success in all of your matters. Inshallah ta'ala, we'll close out Bisir Asrar al-Fatiha. So we remind you, tomorrow morning we start off at 6:15 with Sheikh Abdurrahman Al-Qattab in his teaching the book Ar-Risalatul Jamia, or the Encompassing Epistle. And then at 7 o'clock, we'll continue with the book Ahl Sunnah al-Asha'ira in reading that text. And I wanted to remind some of you that I was talking to the post office today, and they're still having the backlog with shipping out the mail. So I ask you all to be patient. If it should get that there's over 10 to 14, I say 14 days. If it gets past 14 days, or it reaches 14 days and you didn't get your package, something's wrong. So let me know. There is a tracking number for every package go out, and I will have our staff look into it. But please, inform me before you complain, because I don't run the post office and it's a pandemic. But be sure that if you ordered anything, any books, there you're going to get your book, even if we have to resend it. And many have had their books lost by the post office, and we had to resend them books. So you don't have to worry about that, but you do have to inform us that there's been a lengthy time lapse in you not getting your books. So that's the only way we're going to know it, because there are many orders, and there's no way for every single order to check to make sure where it's at. That's why we have the tracking number, so that if we know, we can find out. So inshallah, may Allah make it easy for all of you. Wassalamu alaikum wa rahmatullahi ta'ala wa barakatuh.